What if the most expensive retinoid is not actually the best one for your skin? Welcome to PharmaconHealth, where skincare meets clinical evidence. Today, I am ranking 3 of the most important retinoids: retinol, retinaldehyde, and tretinoin, from least potent to most potent. I will explain which one is most effective, which one may not be worth the extra money for you, and how to use each one without unnecessarily damaging your skin barrier. Maybe you spent £50 on a retinol serum. You have used it consistently for 3 months, but your skin still looks almost the same. This is something I hear frequently in pharmacy consultations. People either spend money on the wrong retinoid, or they use the right retinoid incorrectly. So stay with me, because by the end of this video, you will understand exactly how these 3 retinoids differ, which one may be right for your skin, and how to introduce one safely into your routine. First, let us understand the biology. There is one important fact that skincare marketing often makes confusing. Retinoids do not all act in exactly the same way. Tretinoin is retinoic acid itself, the active form that binds directly to retinoid receptors in skin cells. Retinol and retinaldehyde are precursors. Your skin must convert them into retinoic acid before they can exert their full retinoid effect. Think of retinoic acid as the final key that fits the lock. Retinol is farther away from that final form. It must first be converted to retinaldehyde, and then retinaldehyde must be converted to retinoic acid. Retinaldehyde requires only one conversion step. Tretinoin requires no conversion at all. It is already retinoic acid. That is one reason tretinoin is generally more potent and why it is. Prescription only in many countries. Now let us rank them for overall clinical efficacy. Tretinoin comes first. Tretinoin has the strongest evidence for treating acne and photoaging, and it can improve collagen production, skin texture, pigmentation, and fine wrinkles over time. Retinaldehyde comes second. It is closer to retinoic acid than retinol, so it can provide a stronger retinoid effect while often being better tolerated than tretinoin. Retinol comes third for potency. But that does not mean retinol is useless. It is widely available, usually easier to tolerate, and can be a reasonable starting point for beginners and people with sensitive skin. Now let us look at irritation. Here, the ranking changes. Retinol is generally the easiest to tolerate. Retinaldehyde comes next. Tretinoin is usually the most irritating, especially during the first several weeks of treatment. Redness, dryness, peeling, burning, and temporary worsening of acne can occur. This is why stronger does not automatically mean better. The best retinoid is the strongest one your skin can tolerate consistently and use correctly. Now let us talk about cost. Retinol is usually the easiest to buy without a prescription and can be relatively affordable. Retinaldehyde is often more expensive because it is positioned as a more advanced cosmetic retinoid. Tretinoin may actually be inexpensive when appropriately prescribed, depending on your healthcare system and formulation. But I strongly recommend avoiding unverified online sellers. Prescription medicines purchased from unknown sources may have problems with authenticity, storage, quality, or safety. So which one should you use? The answer depends on your skin, your goals, your tolerance, and your access to medical care. If you have never used a retinoid before, retinol can be a sensible starting point. If you have already tolerated retinol but want a stronger cosmetic retinoid, retinaldehyde may be a reasonable next step. If you have significant acne or established photoaging and need the strongest evidence-based topical retinoid, tretinoin may be appropriate, but it should be used under appropriate medical guidance. Now let us talk about how to start. Do not begin by applying a retinoid every night. Start slowly. Use it about 2 nights per week initially. Apply a small, pea-sized amount to the entire face. Avoid the eyelids, corners of the nose, and corners of the mouth, because these areas are particularly sensitive. Apply it to completely dry skin. If your skin is easily irritated, you can apply moisturizer before the retinoid and another layer afterward. This is often called the sandwich method. It can help reduce irritation while allowing you to continue treatment. Then, As your skin becomes accustomed to the retinoid, you can gradually increase the frequency. Do not increase the frequency simply because you want faster results. More product does not mean faster results. It usually means more irritation. And there is another step you should never skip. Sunscreen. Use a broad-spectrum sunscreen every morning. Retinoid treatment does not replace sun protection. In fact, if your goal is to prevent photoaging, daily sun protection is one of the most important things you can do. Now let us discuss some common mistakes. Mistake number 1 is using too much. A pea-sized amount is generally enough for the entire face. Mistake number 2 is starting too frequently. Your skin needs time to adapt. Mistake number 3 is applying the product to wet skin when you are prone to irritation. Wait until your skin is completely dry. Mistake number 4 is giving up too quickly. Retinoids are not overnight treatments. Visible improvement can take several months, and consistency is more important than aggressive application. Mistake number 5 is forgetting sunscreen. You cannot effectively manage photoaging while repeatedly exposing your skin to ultraviolet radiation without protection. Now, there are some important safety considerations. If you are pregnant or trying to become pregnant, speak with your doctor before using topical retinoids. Topical retinoids are generally avoided. During pregnancy, if you are breastfeeding, ask your healthcare professional about the specific product you are considering. Also, if you have eczema, rosacea, active dermatitis, or a severely damaged skin barrier, speak with a dermatologist or healthcare professional before starting a retinoid. And be careful about combining retinoids with other potentially irritating products. Strong exfoliating acids, scrubs, and other active ingredients can increase irritation when combined improperly. Sometimes alternating products on different nights is a better approach. So here is my final ranking. For potency and evidence in acne and photoaging, Tretinoin comes first. For a balance between potency and tolerability, Retinaldehyde is an excellent middle ground. For beginners, prevention, accessibility, and tolerability, retinol remains a useful option. But remember this: retinol is not a bad product simply because it is weaker. A product you can tolerate and use consistently may be more useful than a stronger product that constantly irritates your skin. If you are using a retinoid and experiencing persistent burning, severe redness, swelling, or significant dermatitis, stop and seek professional advice. And do not judge your results after only a few weeks. Retinoid therapy requires patience. Think in months, not days. So, 3 things to remember. Number 1, Tretinoin is generally the most potent of these 3, but it also has the greatest potential for irritation and usually requires medical supervision. Number 2, Retinaldehyde can be an excellent middle ground for people who want something stronger than retinol but are not ready for Tretinoin. Number 3, retinol remains a reasonable choice for beginners and people who prioritize tolerability. And no matter which retinoid you choose, 3 things matter enormously: consistency, sun protection, and patience. If this video helped you understand retinoids more clearly and helped you avoid wasting money or unnecessarily irritating your skin, subscribe to PharmaconHealth. Share this video with someone who is using a retinoid incorrectly. And tell me in the comments which retinoid you are currently using and what results you have experienced. Thank you for trusting PharmaconHealth with your skincare education. I am a clinical pharmacist, and here we bring skincare together with clinical evidence. Remember, better skincare is not about buying the most expensive product. It is about choosing the right evidence-based treatment and using it correctly.